finished a bachelor's. I said, I'm never going back to school. I did. I went back and got my master's. I'm in the PhD program at Villanova University. I started out as a bedside nurse. I've been a nurse practitioner for 10 years. I've been teaching for 10. Keep it short for right now.
All right, I'm Stephen Blanken, and graduated here in 1985, BS in psychology. And I'm from here, Springbrook High graduate. I don't know if there's anybody in here from there. Okay, very good. I always see one. I remember coming to one of these meetings when I was a student. I feel very old right now. I'm the oldest one. And I went straight from here to podiatry school in Philadelphia, which was after Temple. But it wasn't Temple when I was there, but it was part of it. And then I did 2 separate residencies, specializing in foot and ankle orthopedics and foot surgery. And then I have a private practice in Silver Spring, where I'm from. And that's basically it. We'll talk more when we get more detail.
Hi, my name is Allison Luckman. I went to Towson University for my undergraduate degree and got my bachelor's in health science. And now I am at the University of Maryland, Baltimore, downtown dental school in career in dental hygiene. We are a bachelor's program. It is a 2-year program. You do 2 years out of prerequisites and then 2 years to get your bachelor's. However, I already have my bachelor's, so I'm going for a second one. It's your choice, probably about half and half we have. And I have more information. I'm on the admissions committee, so I can speak to you a lot about that. And I love what I do, and I'm excited to actually get out and practice. I graduate in May, and it's really a great occupation.
Hi, my name is Alden. I graduated from 2005 from here. I was a psychology and a biology major. I got to the point of, I took the MCAT before I realized, and I was pre-med and all that great stuff, before I realized I didn't really want to go to medical school. And so I graduated in 2005, and I found a job at the U.S. State Department in D.C. for a year. Until I could sort things out, and then I started, I realized that, I really want to go into public health, because, public health is looking at systemic solutions on population levels. And so I started a master's at Hopkins in Baltimore, and I stuck on for a PhD, and I'm defending a thesis in 2 months.
Drew Morano, wear a few hats. I'm a physician assistant. I work at the Trauma Center at GW downtown in DC. I teach for the med school and for the residency programs in the Department of Emergency Medicine. I'm the assistant medical director for the National Medical Response Team for the National Capital Region doing disaster medicine, and then hold the title as president-elect of the DC Academy of PAs. I, as an undergrad, thought I was going to be a doctor, did the whole pre-med track. Was also a paramedic at the time in undergrad and ran with the local fire and rescue squad. And after graduating, said, I don't really know about the next step for me right now is medical school. Let me take a couple of years off. Continued to practice as a paramedic and kind of got open to other professions other than being a doctor, one included being a physician assistant. Went back to do my physician assistant program at James Madison University. And have been practicing for the last 7 years now as a PA in DC.
I guess we can open it up now to questions you might have for our panelists.
I'm interested in deciding. I also have a bachelor's from here. I'm actually in the public health program here for master's, and I literally decided I woke up and decided I want to go to medical school, and I've been looking for schools now. And I know most schools in Maryland are just 2-year programs. And when I saw that UMB was a bachelor's program, I didn't understand how that works. Does that mean I can just transfer whatever I have right now over to UMB and just finish the 2 years?
It would depend on your prerequisites that we have in that pamphlet, and you have all of them, or you still need to do 1 or 2. Once you have all of those, you apply, go in 2 years, you will get another bachelor's, and that's it. But yes, it would only take you 2 years.
If I didn't do, say, some of the prereqs, or no, can I take them next semester? semester and then start nursing program in the fall, or is it not?
Yes.
I can't do that.
Dr. Blanken, if I can ask you, what made you go into podiatry?
Well, for one, I had foot problems. I still do, sort of, but they're okay now. And my middle name is Selby, which my grandfather, Dr. Morris Selby, was a podiatrist in Washington, D.C. So I saw a lot of his practice and was his patient too, and started getting into it at an early age. I have a 16-year-old son at Richard Montgomery High School right now that wants to be my partner. So he has a little way to go. I said, why don't you try to get into Maryland first down the line, you know? So I want him to come here. I like this school. This is where I went. But I wanted to be in a field where I can be a doctor, be a surgeon, but still have a decent life for myself. And I could make it as hard and rigorous as I want. If I want to be outpatient only in a practice, I could do that. I could still have inpatient care with a lot of infections, diabetic care, things like that, sort of in a hospital and in the practice. And the nice thing about the state of Maryland is we're allowed to have our own freestanding ambulatory surgery centers. So I actually have my own surgery center in my office. So most of the procedures I do, ranging from bunionectomies, fractures, heel spurs, hammer toes, tumor removal, they can all be done in my surgery center. So it's really nice when you can be your own boss. You can really set the stage. You could potentially even be a part-time doctor if you want to have a family, and then just do this 3 times a week. But that's what got me into it, and it's satisfying seeing what you can do to people pretty fast and getting rid of their pain. Yes.
I just have a question. It sounds like a lot of you guys chose not to go to medical school. Do you ever, like now, do any of you guys ever regret the decision, or like think you maybe like 10 years down the line should have gone to medical school?
Yeah. I actually decided in my sophomore year of high school that I always thought I was going to be a physician. I always wanted to be a pediatrician, actually. And then my sophomore year of high school, I was like, no, because I don't want to be in school forever. So the irony of it is I am in school forever. At 45, always been in school. The answer to that is no. You define yourself, what you want, the satisfaction, and I also thought I was going to become a pediatric nurse, and I'm not a pediatric nurse. I wound up becoming an adult nurse practitioner. So for some people, everybody's different. For some people, they know from the day they come out of the womb almost what they want to be, and they follow along on that path. It's okay that you're still sort of trying to figure it out. I don't have any regrets. And I have students who come into the nursing program thinking that they're going to finish the nursing program, they're going to do the 4 years and then apply to medical school, and a lot of them don't. I think the one thing for nursing is that there's so much to do. You can still do research, you can still do primary care, you can do trauma, you can do, combination of both. You can teach. It's just very wide and varied. You work for a pharmaceutical company. So there's a lot of options for you.
If I can add, I wanted to be a podiatrist since I was probably 8 years old. And the thing is, at least in my field, it basically is medical school. It's just its own specialty from the beginning. There's 9 schools in this country, and it's basically very similar to the med school track. You could take the MCAT, you need to take the MCAT. There's now mandatory 3-year residency following podiatry school. And you can specialize, just like you were saying, in different things: geriatrics, pediatric, podiatrics, surgery, research, basically everything she just said, we can get into. So it wasn't really a choice for me, because one of my big things, and I know there's pre-med people in here, is if you say to yourself, I want to be a plastic surgeon or an OBGYN, and you go to med school, and I'm not trying to discourage people to go to med school, but if you go to med school and you don't get that specialty or residency in that, than if you only wanted to be that OBGYN, but the residency you get is internal medicine or neurology. Are you going to be upset? Are you going to be happy? I mean, you got to ask yourself, if you want to be a physician or a doctor, at least give yourself the experience during that schooling to see what disciplines are out there for you, because you might not know enough about it. So the thing that I encourage, and I'm sure everybody here would, is try to visit people in the specialties, go to their offices, their hospitals, you can probably get people to watch you in the clinic, and the PA thing, there's a lot of people doing that, and you need to see what an average day is. You need to spend time with them on your own time. Please don't apply to med school or any of these schools without ever spending a day in that field, at least a day.
I think it's a great question. It's a question I get asked probably weekly by students that I work with or patients that I see. And I think, she had it directly on. You got to look at yourselves and define yourselves. If your goal to become a doctor is to become a doctor and to have that title and to do those things, I would go for your dreams, okay? For me, I wanted to treat patients. I wanted to practice medicine. I wanted to make a difference in people's lives. But I was comfortable doing that as a team approach. I'm comfortable working, under the supervision of a physician, whether that's that person by my bedside or that person just on their cell phone. And I'm comfortable, and feel like the goals that I set out for to make a difference in patients' lives are being met. So it all depends on what your goal is. If you're in a pre-med track, of what your goal is to be when you become that doctor. If that's your goal and that's your dream, then you should go for it. The PA programs nationally are recognizing what they're saying, that there's so many options out there and there's so many ways that you can make a difference in medicine, that PA programs are now requiring you to have clinical hours, whether that means being a tech somewhere or volunteering somewhere that you can see what the true patient care looks like, see the job of the nurse practitioner, of the podiatrist, of the PA, of the physician, and really see what your true niche is in medicine. And it really helps to define yourself going forward. So I would encourage you as a student, just if you start having questions of where your future lies, just start getting involved, either volunteering or finding some way that you can become a little bit more hands-on and experiencing some patient care.
I would add to this, not only look at what goals that you think you have now, but also look at the interest that you have right now. I really like numbers. I like playing with numbers, and I like variety in life. And so in public health, one day doesn't have to be the same as the next. I can work with different people and different individuals. I love it.
In reference to being a physician assistant, can you more, what is a physician's assistant? I've always been confused about that versus a medical doctor, and specifically maybe in schooling, because I know if you go med school, like you guys said, you have to be in school a long time.
Sure, happy to say. It's a profession that's new. It's a profession that started in the late 60s as a whole bunch of corpsmen and people who are trained in medicine started leaving the Vietnam War. They realized that there's a large shortage of medical doctors out there, and the shortage is going to be worse. So Duke University in the 1960s came up with a way to transition people who were mainly military into civilian life. And what we found is that the program has developed into a lot of them are moving towards masters, like a lot of the different health sciences are, but there's still some bachelor degrees out there. It's pretty much 26 months of, I call it macro med school, so that you're going to do 3 semesters of didactic work, exposing you to the medicine aspect and developing those things, but more basic sciences. And then you'll do a year rotations, the same as the med students do, of the various subspecialties out there. Physician assistant's role in medicine is to practice medicine. You can see patients, diagnose patients with their labs, everything pretty much a physician can do, but it has to be done under the supervision of a physician. Now that definition changes by state. In Maryland, physician assistants must have a physician who's responsible for that person. They don't need to practice next to them. They just have to at least be on their cell phone in case the physician assistant has questions. And they don't need to co-sign their charts. In some states, a physician assistant must have all their charts co-signed within certain periods. Some of the restrictions are that cannot lead in surgery, they can first assist, they can help the surgeon. They can't function within the field of radiology unless they get another certification. Some of the hem-onc, doing chemotherapy and some of this pharmacological stuff is what we call out of our scope of practice. It's a means to see patients and practice medicine because it's more of a team approach. You'll see a lot of people start lumping PAs and nurse practitioners as mid-level providers. And there's some distinctions between these fields. And a lot of hospitals are using PAs along with nurse practitioners to expand the ways of seeing patients. Right now, it's very difficult for patients to be seen or to develop or to get care done. So by using like physician assistants or nurse practitioners to expand that care, a lot of hospitals are moving towards developing services that are solely run by them or using those mid-level practitioners to open access to care to patients that would never get care. That answer?
Yeah.
I also have a question for it's like in the typical day at a trauma center, it's at a
Yeah, it depends on your role. Now, so I also work at PG County Hospital, and there the PAs assist the trauma surgeon in actually doing the hands-on and running the trauma. At GW, it's completely run by our surgical team, so I assist when need be, but a lot of it's going to be done by an actual surgeon. So it depends on which type of trauma center and which level you're at, the role of the PA in that institution.
And Nick had asked me to just introduce myself. I apologize for coming in late. I'm Dr. Emily Telfair. I'm a naturopathic doctor practicing in Baltimore, Maryland, which is why it took me a little longer to get here today. And I'm also a licensed massage therapist in Maryland, and I also practice cranial signal therapy. So I'm not sure what questions have already been addressed, but I just wanted to introduce myself.
Dr. Telfair, can you elaborate what exactly is naturopathic medicine?
Sure. Is anybody here familiar with naturopathic medicine? This is somewhat, okay, some people kind of maybe heard of it. I imagine you're all health-minded if you're here. So naturopathic medicine is another type of primary care medical degree that's available here in both in the U.S. and Canada. There are 4 naturopathic medical schools in the U.S. I attended Bastyr University in Seattle, Washington. And naturopathic training is similar to allopathic training of traditional Western physicians in that the first 2 years cover a lot of the basic medical sciences. You take second cadaver, you take biochemistry, pathology, all the basic medical sciences. And in addition to that, you take courses in clinical nutrition, homeopathy, botanical medicine, physical medicine, hydrotherapy, massage, different manipulation techniques, lifestyle counseling, and emotional counseling. So it's a very much more a holistic approach to healing. In states where naturopathic physicians are licensed, we can practice in the scope of primary care physicians. Maryland is currently not one of those states, but we do hope over time to get a license here in Maryland that allows us to practice in the full scope of our training. That gives you a little background.
Question for you also. Where did you go to school?
So I went to Bastyr University in Seattle, Washington for my naturopathic medical degree, and I did my undergraduate training at University of Dayton, Ohio. I'm not originally from there.
Oh, so how did you decide to get into that field then? What made you
Exactly. So I grew up in St. Louis, so in the Midwest, and I'd never actually met a naturopathic doctor before going to school to become one, which was a giant leap of faith. And but I'd always had an interest in biopsychology and mind-body connection, and really, I grew up. My mom's a nurse, my sister's a nurse, so definitely have an openness and to the Western medical approach as well. But I always just kind of knew there's a little bit more to healing. And when I had a friend during my freshman year of college actually told me about naturopathic medicine. She was studying nutrition at the time. And as soon as she told me about it, it just was like, the moment where you just kind of know where your path is supposed to go. And that's fortunately how it happened for me. So I did a lot of research and amongst the schools, which are all good. They're all located in different areas of the country. But Bastyr is really known for a kind of a science base in natural medicine. So it has a very strong emphasis on understanding the science behind the natural approach to healing, which there's a lot of research to support. So that's kind of how it just kind of landed in my lap. But it felt right. That's became my path.
Allison, can you touch on what the differences between dental hygiene and being a dentist?
Yes, I actually wanted to be an orthodontist. We all know that word. And I actually, when they were talking about, I observed a hygienist and fell in love with it. They are the cleaners, which we hate to say, and because there's so much more to what we do than that. We are healthcare providers. We are now just the law passed that we can give local anesthesia, the needles, the numbing needles. So that's a big boost to our profession. We work under a dentist or all types of dentistry, pediatrics, etc. We can work in the public health arena, which that's my passion. That was my undergrad, so I'll probably do something like that. Keeping your overall health, your dental health relates to your systemic and your body, and we try to make that connection to our patients. And it's a very flexible career. You can work in multiple offices at once, 3 days here, 2 days there, etc. I just like helping people. I like the communication. I like the relationship with the patients that I get.
I have a question with regards to public health. So I thought it was interesting that you were a science major in biology and psych, but then you also did an internship at the State Department. And it's kind of weird to design bio, but I'm interested in international relations too. So I was wondering, I have a couple questions. One, did that experience somehow influence your decision to go into public health, or how did that experience affect you? And two, since public health is such like a very large field, like what are you currently studying for your PhD, and what do you hope to do after you finish? That's a long question.
Great question. So I took the job at the State Department because, I applied to like 60 jobs after I graduated, like all these labs and stuff, and I didn't hear back from any of them. And finally, around August, a friend from high school, emailed a bunch of us and said, I'm leaving my job. Does anybody want to take this thing? It's a pretty sweet gig over it. I was like, okay, I'll do it. So I did that for a year. It gave me a lot of time to think about what I wanted to do. I knew I was interested in something related to health, and so I wanted to get a master's in public health, so I went and did that, and I realized that I like the research. Particularly what I'm studying right now is cognitive health and everyday functioning in older adults. And so, after I defend in December, I'm moving to a postdoc up in Boston at Harvard. But in addition to older adult stuff, I also have a master's in biostatistics, and so I consult with a lot of people on a lot of other data sets relating to autism or Huntington's disease or children affected by political violence in Kenya or something. So, there's a lot of variety in what we do, and so I'm trying to, I enjoy that. Did I answer everything?
Yeah,
Sweet, it's kind of stuff.
I'm basically leaving Masters in Public Health to be a dental hygienist, but I guess my decision came to when I came to this conclusion after working and experiencing public health field. I don't know if I'm really interested in the research aspect. Is that what you can do mostly? I know epidemiologists can travel and study epidemics. What else can you do with an MPH besides just the research aspects and just
So I think of an MPH as professional and not as research. You can definitely use an MPH for research. I think of it as, how do you administer things, and with that, whether you work on the state level or the federal level, or in some other way in public health. Public health is kind of a really broad thing, so you work in it, so you probably have this idea. if you're in a university setting, I would probably do think that the MPH is more research-based, but you can always go outside that. Do you have any thoughts?
A lot of, because I did the public health as an undergraduate, a lot of my classmates went on to get their MPH. A lot of administrative work, things like the NIH, tons of things besides research that you can do with public health. So, I mean, very long.
We actually had a student who came into the program with a master's in public health. She was on the policy side. And she switched into nursing because she wanted to know how policy was impacting patients every day. And now she's getting a master's in the nurse practitioner program, hoping she can tie all three pieces together.
That's what I hope to not just work in private practice. That's the beauty of getting a bachelor's in general hygiene. I hope to work in public health, work with underprivileged communities and things like that, with the oral health care, the communities that are most in need. And it is my passion, so I will be trying to work them together once I graduate.
Yeah, I work with a lot of people that work in public health. Research is an area of I work with people on a daily basis. I write policy. I look at needs assessments of DC and where people are getting care and not getting care, and kind of do those things. I work with people who help set up the clinics or help set up pathways for people to get care. So there's a lot of operational type environments, whether it's national, international, local, whatever, and then kind of just reaching out in terms of seeing what other niches in terms of the whole public health agreement have a role to play. So I think it's a very broad, you can do whatever you need to get involved in.
Just for a couple members on the panel, what did you feel are the pros and cons, if any, of majoring in psychology as an undergrad?
Well,
Okay, like I also did, so maybe the purpose did.
you were too, right?
No, not me.
Two of us have psych degrees. You go first.
All right, so I had a dual major in biology and psychology, and for me it helped tie in that mind-body connection. I also then did a year after undergrad working as a volunteer chaplain in a hospital, which brought in the mind-body spirit aspect. But psychology, I think, is a real helpful fundamental way to learn how how we all relate, and also to learn more about the individual human experience. And that's really, I think, what the core of healing is letting people be with their human experience, whether it be, tragedy or loss or joy or whatever it is, but to help people understand themselves better, and learn how to kind of range. There's another field of pathology too. Mental illness depression is probably one of the number one disabling disorders right now in our country, aside from all the chronic inflammation. But why is it is? Yeah, we're, as a nation, there's a depression among us, and what is it? People kind of lost touch with themselves and their spirit, and there's a lot of reasons for it. I think psychology helps at least open the door for some of that.
Yeah, I'll start out with a joke, but it's true. When I came to this university, I knew I wanted to be a podiatrist, so I had to be pre-med. It's basically the same course as the MD track, so I had to take your biologies, your organic chems, and all that stuff. So I said, I don't need to major in chemistry, I don't need to major in biology, and I could if I want to. I said, but what am I interested in? And I like psychology. But the joke of it is that the girl-boy ratio was like 4-to-1. So I said, okay, this is a good way to meet girls. So, but it's honestly the truth. But the thing is, I still had to take all those science classes. And I'm glad I did it because I feel that, like what you were saying, I have patients that come in, and a lot of times I'm working with my hands, and I'm talking too, and I sometimes feel them they're psychologists because they're talking constantly. Now, the hygienists, they have a different problem because how do you talk when they have it in their mouth? Because I really thought about being an orthodontist for a while, and it was funny because that was one of the reasons why I didn't, because I like to talk a lot and talk about sports, talk about the Terps and all that stuff. And so, but the thing is, I tell people, they say, what, you're a psych psych degree and your DPM, why do you, what made you go to those two extremes? And I said, I want to be able to cover people from head to toe, but nothing in between. And the thing is, though, half of their illnesses or problems or complaints, you need to see, is this really a physical problem? Is it really an injury? Are they being a little psychological? And I have a lot of psychological patients, and I refer to a lot of psychiatrists and psychologists and pain management people because you need to know your patients mentally. So I hope that answers your question.
So I enjoyed being a psychology major, almost more, well, definitely more than I enjoyed being a biology major. I learned a lot about, memory and the theory of memory, and I really brought that into my doctoral work. So, and I'm studying public health, but I'm in the Department of Mental Health. And so my work is really kind of at the cusp of studying how memory in particular affects functioning on a population level in older adults. And so, even though my graduate training is in, epidemiology and biostatistics and stuff like that, I'm glad that I have that background in psychology and specifically cognitive psychology.
My question is for you. I'm not sure what your name is. Yeah. What were your previous experiences before you became the CEO of your company right now, and how has those experiences led you to the position that you have right now?
Well, when I was in my last year of residency, my residency director was a very powerful man. I was scared to death of him, and there's a whole seminar named after him. He's passed away since, and I said, Dr. Goldfarb, you know anybody in the Maryland area that can hire me, I'm finishing soon. And he had a real raspy voice, and he said, Steve, you need to go out on your own. I said, why? And he said, because you don't listen to anybody. You want to be your own boss. And he was right. Everybody in this room has to sit there and figure out, do you want to be your own boss? Do you want to be, or can you be a team player where you have to answer to people, or can you do a little bit of both? A lot of podiatrists come out and doctors, and they don't know a thing about business, not one thing. And they don't know how to make it because they owe around $150,000 to $200,000. I assume in your schools too, it might be somewhere around that much when you finish, and they're scared to death about their debt. And so one of the things that I did was I got into business immediately on the social level with people that trained me. So when I came out, I listened to Dr. Goldfarb, and I started my own practice. I just went out cold, and I called friends up every single day. And this is when we didn't have cell phones and free long distance. And I was calling them and like saying, okay, how do you bill for this? What do you do for this? What do you do for this? So I also was a former residency director, and I still participate in the Washington Hospital Center for residency training. And I tell my residents, I say, you need to come in and learn the business, or you're just going to, sort of be in the shadows a little bit. So it's important to get all that. But I felt like I could get as much as I want, do as much as I want, enjoy my now 3 kids. I'm a new dad again, and with this type of field. I also wanted to make a decent income because we weren't in a recession when I came out, but we were in this HMO crisis. And she's more my contemporary here, but so she knows what I'm talking about. But the thing is, I wanted to go into a field that wasn't overpopulated. And I believe, correct me if I'm wrong, because even though I was very good at statistics, but he's the stat person, I think there's a shortage in most of our fields right now. At least in mine there is. And so if you think you're going to come out and not be able to get work, if you look hard enough, you will. Because there's too many people retiring because they don't like how things are going with the healthcare thing. And obviously everybody in this room is somewhat serious about being some type of medical type field professional, even though you hear people saying don't do it, Medicare is going to end, and somebody's going to have to pay for people's health care. I mean, so somehow there's going to be a business for us. And before I talk too much about this question, because I did mention money, my association gave me a fact sheet, and they just listed the average income for podiatrists, owners and employees together, which I think is wrong because I'm an owner, but employees too. The average income from 2008 was $181,000 a year. Now that does not include if you own your own surgery center or if you're basically on your own, because it's probably more. I don't know what the other fields are. I know this is like I believe in the top 6 of medical professions, but it's a decent life if you work hard for it. It's not going to be given to you. None of these fields it's going to be given to you. You have to go out and get it. I hope I answered your question.
I have a question for Dr. Morgan. About the James Madison program you said you went to, like, what was your undergrad before you went to there? I know they require that.
So I did a biology health sciences bachelor, but pretty much did the pre-med track. Physician assistant programs can differ a little bit from the MD tracks, and a couple of the schools have now required a couple other things. Some students, if you want to be a PA out there, really look at what schools you're applying to. Because some schools now want you to take an abnormal psychology degree. Some want genetics. Some don't want the full year of physics. They're all right with the 1 semester of physics. Just kind of, as medicine changes, they're adapting some of the prereqs, but it's still pretty much the board.
So another question about it. What's like the average amount of hours usually because of school works?
Depends on where you're working. So right now, it's still the majority work in primary care setting, so that's going to be pretty much a 8 to 5, 8 to 6 kind of office space as your doctor would typically work. And then right under that, the majority of people work in hospitals. And depending on what specialty you work in or where department you work in, that could still be a 9 to 5 if it's clinic-based, or if it's hospital-based on the wards or the ER and surgery. A lot of people, or a majority of the hospital people, will typically work 3 12-hour shifts a week.
I have a question for you as well, or 2 questions actually. What is the average income for a PA, and also as a PA, do you feel like you are respected by medical doctors, or are you still kind of like underneath of like one layer under them in terms of respecting you?
Sure, I'll start with that question. It's definitely a new profession. Some people are not as knowledgeable of it, and sometimes you have to work around that. The environments that I work in are teaching institutions where there's a large PA programs, so everybody there are pretty comfortable with physician assistants and the other team members of what makes up our medical teams now. So no, I think the PA profession at my institutions is very highly regarded, but there's still some education out there to be done to some people regarding everything and what everybody's role is out there. So I think that every profession is going to evolve as the education builds. PA, it was cited as World News Report as probably the best profession for the money regarding the income that you put into it. Primary care PAs right now are averaging about 88 to 90,000, depending on where you're working. If you move into the hospitals and you're in the surgery areas, you're about 109, 110,000. And some of the advanced, more narrow niches, emergency medicine, cardiothoracic surgery, that PAs are getting involved in would be about, I think it was 119 last year, being the average.
Can I piggyback off of that? One of the questions I get a lot is, what's the difference between a PA and a nurse practitioner?
A nurse practitioner is somebody who has essentially, if you were to go full-time, 6 years of education, starting out with off the bat. A lot of times it's longer than that because nurses will typically do the 4 years of the bachelor's, work a long time in a particular specialty, and then go back to school for the master's in that specialty. In terms of practice, it can vary from state to state. In Maryland, nurse practitioners have their own license. They have their own prescriptive authority. They can start their own business as a nurse practitioner. But, just like he said earlier, they work side by side a lot of times in many, many settings. So it really is, and they've been around since 1965, and one of the things that is little known about this, it was started by a physician and a nurse, the role of the nurse practitioner. So in 1965, they still see the same amount of patients. They don't have the same scope of practice when it comes to first assist and the OR. And so a lot of times when people are deciding, because they want to have that first assist role, they decide to go to PA school versus going to nursing school. And the other thing is it depends on what you want to do. To become a nurse practitioner, you have to do the 4-year degree in nursing. And for some people, they don't want to do the fundamentals of being a nurse, and that's okay. That's your prerogative to do. People will make the argument that in nursing you're taught to look more broadly at a patient. I would agree with that, but not to the exclusion of other professions. I think that everyone is starting to understand that you need to look at the whole entire patient, not just focus on the diagnosis. PAs have a tendency to be a little bit more medically focused than nurse practitioners do, but when the rubber hits the road, they're still prescribing the same, they're still diagnosing, they're still treating the same. I hope that answers it a little bit better.
I think that was a good synopsis. PAs still can prescribe. We have full prescriptive rights. It's a different model of medicine. The nursing model of medicine is different. We learn and do our didactic alongside the med students, sometimes even in the same classrooms in universities, and do our rotations alongside the med students. It's thought of through the physician model of medicine, where we take the ideas of medicine and then go forward. We're trained and we can practice in any type of medicine. I could be in the ER today, but I could decide to go into OBGYN tomorrow, and then next year go into surgery. So we're trained broadly and are allowed to interact with patients on various settings, which was a very positive thing for me, because I was one of those people, even as undergrad, I was like, oh, I'm doing this, but I really like that, so do I want to commit? And that was one of my fears of going to med school, and I wanted to be an ER doc, and then down the road, did I not want to be an ER doc? So it gives you a little bit of latitude. And it's, in some of the nurse practitioner models, it's a little bit more specialized. You can specialize in things like neonatology or geriatrics or women's health and those type of things. So there is some pros and cons in both of those. And if you're interested in either one, I'd really look into what your goals are in the various programs.
Question for you. What are some downsides to being a dental hygienist?
Well, you have to work under a dentist or an orthodontist or someone, so you don't have your own practice. You don't get paid as much.
Just like tedious. Some people told like sick with older people included by me. Some people a little bit more critical, just like that. It's just tedious for, I don't know,
I think it can be tedious if you are treating every single patient the same. And you're just going in and you're doing your thing and you're fatiguing yourself out. Every patient is different. We look at the whole body. We're trained in tobacco counseling, nutritional counseling, your body. We're talking your body as a whole. You know, these patients talk to you. You talk to them a lot because you're, in their mouth. They confide in you. If you want to make it tedious and do the same thing day in, day out, treat every patient the same, I think that it can become tedious. If you are in a very small cavity, the oral cavity is small, but we're taught to look at the whole body and teach the patients why oral health is so important. And I have heard that, from people, and they know I'm in the field, and I can see how it can, but I have a passion for it. I'm a people person, and
I think to dovetail on that, one of the things, with the exception of you, that people would say is that, you're so smart, why aren't you
Yes.
a physician? You're so smart, why aren't you a dentist? Part of that stems from historic precedents of the physician having social standing, and people not really realizing until they actually get health care that it does take a team to carry out aspects of care, that it can't be done by one person alone. And so when people make those remarks, that's part of it. I spend a lot of time in my career with family, with friends, with whoever, with parents saying, why am I sending my daughter to nursing school? Why am I sending my daughter to an expensive college to go to nursing school? Is educating about the practice model and what the opportunities are. And you need somebody smart to do all of these roles. You all need science, we all need math, we all need to have a good understanding of anatomy and physiology to carry out our roles. And knowledge is not just owned by one particular discipline. Knowledge is for everyone.
I have a question for the naturopath. What experiences have you had that really attracted you to this career? Could you tell us all for people who aren't in the office for learning about the benefits of this versus how it
Sure. Some people also can think that, it's either, the allopathic way or not, and that's not necessarily the case. Even within the naturopathic scope of training, there's a core fundamental. If you go all the way back to Hippocrates, one of the oldest healers on record, what did Hippocrates say? Use food as medicine. So, I grew up in a household, right, Captain Crunch and Pop-Tarts, and grew up on TV dinners. So, I didn't just get born this way as far as being drawn into a natural health profession. I had shared a little earlier, maybe you weren't here, that I was kind of just, it was something that I was told to me. A dear friend of mine told me about the profession, and I just kind of knew. But it really stemmed more from seeing healing as something deeper than just a diagnosis and medication. I fortunately also grew up fairly healthy. I didn't go to the doctor very much. I hated shots. So the last thing I wanted to do was become a physician, but here I am. So when I read more about the naturopathic medical program, what really drew me in was seeing the breadth of the training. I mean, I loved science, and I love math, and all those, I was a biology major. But then also seeing that I'd get to take classes about, doctor as teacher, physician heal thyself, learning about the philosophy of healing, and really seeing how a lot of naturopathic therapies stem from the more Western European traditions of water therapy. In England, a lot of the old herbal medicine traditions, homeopathy, which was originated in Germany. And a lot of those traditions came over to the U.S., back with the early settlers. That's why in Pennsylvania, homeopathy is so prevalent among the Amish. They don't like to use Christian medication. So it's part of our history as a nation, but it got lost along the way. Some of you may know of in Pennsylvania, Hahnemann Medical School. That was originally a homeopathic medical school. There were homeopathic hospitals. Even in Baltimore, Maryland, there was a homeopathic hospital. So it's not really that old in our history, but it did get lost, and now it's starting to come back because people are looking for another way. Sometimes a lot of the patients I see are also under the care of many other practitioners, which I encourage them to keep seeing and be in communication with, but they're often coming because the certain therapies they tried haven't worked. I haven't gotten to the root of it, and so I can offer at least another perspective. Kind of really, the goal of naturopathic medicine is to treat the underlying cause, and really spend the time to try to find out what that is.
And how long is this school?
It's a 4-year medical program.
You said only certain schools have it?
Well, yeah, there's only 4. They are themselves naturopathic medical schools. Some of them also have a master's in acupuncture and some other degrees as well. There's one in Seattle, in Oregon, and in Arizona and Connecticut. Connecticut would be the closest. And I do have brochures up here if anybody's interested. I'm also the vice president of our Maryland Association of Naturopathic Physicians. And so the brochure here describes a little bit more about the training and how we can, a little more background about naturopathic doctors.
Any more questions?
I'll learn everything you want to know about becoming healers.
Well, I guess if there aren't any more questions, I'd like to thank our panelists for coming out and sharing their experiences with us.